Good afternoon and a warm welcome to today's program, the CSIR-CFTRI Platinum Jubilee Lecture Series 24-25 and the celebration of POSHAN PakHWADA 2025. Distinguished Chief Guest, Dr. B. Sesikeran, MD, Fellow of Academy of Medical Sciences, former Director, National Institute of Nutrition, Hyderabad, respected Director, Dr. Sridevi Annapurna Singh, distinguished invitees, scientists, staff, alumni of CFTRI, media personnel, and dear students. With a big round of applause, may I now request everyone to warmly welcome today's chief guest and the director onto the dais, please. Thank you, sir. Thank you, ma'am. Nutrition and food technology are closely twinned disciplines, working hand in hand to address public health challenges. In alignment with this vision, our institute, CSIR-CFTRI, has made a significant contribution towards the national nutrition goal since its inception. The celebration of the institute through a Platinum Jubilee special lecture series has aptly coincided with the Poshan Pakhrwada 2025. It's a key initiative under the Government of India's flagship program, Poshan Abhiyan. This year, the Poshan Pakhrwada is being organized from 8th April to 22nd April 2025 with the theme to spread awareness on the importance of maternal and infant nutrition, enhancing digital accessibility for the beneficiaries, and combating childhood obesity. We are deeply honored to welcome our chief guest of today's event, a widely respected and eminently suited expert in the field, Dr. B. Sesikeran. It's an indeed privilege to have you here with us, sir. May I now request our director to kindly present a bouquet of flowers to Dr. B. Sesikeran as a gesture of a warm welcome. May I now request Dr. Umesh Hebbar to kindly welcome the director to the program with the flowers. Thank you, sir. Moving on with the event, may I now request Dr. Giridhar, Chief Scientist, Chairman, Organizing Committee, CSIR-CFTRI Platinum Jubilee Lecture Series to deliver the welcome address and introduce the chief guest to the gathering. Please, sir.
Good afternoon to all of you. I welcome you all for this Platinum Jubilee Lecture Series. This is the third such a lecture in the Platinum Jubilee Lecture Series. As Dr. Purnima introduced, Dr. Sesikeran Boyindala is the distinguished speaker for today's talk. So Dr. Sesikeran Boyindala was born on July 30, 1951. He obtained MBBS from Stanley Medical College, Madras in 1975. He earned MD in Pathology from Gandhi Medical College, Osmania University, Hyderabad in 1983. Later, he joined in ICMR National Institute of Nutrition, Hyderabad as Assistant Research Officer in 1977 and became the Director of NIN in April 2006 and continued up to August 2012. Dr. Sesikeran joined the after joining the ICMR National Institute of Nutrition. His main focused areas are as a pathologist. He has spent more than 3 decades in conducting research in nutrition, food safety, and toxicology. Throughout his distinguished career, Dr. Sesikeran has published more than 150 publications in peer-reviewed journals and also contributed chapters to various books. Due to his vast experience in nutrition science, Dr. Sesikeran has involved in numerous national committees and also has played a key role in developing guidelines for probiotics in foods, genetically engineered food safety, biosimilar drugs, dietary guidelines for Indians, and ILSI India guidance documents. Dr. Sesikeran's contributions were honored with various fellowships like National Academy of Medical Sciences, International Medical Scientist Academy, and Fellow of Andhra Pradesh Academy of Sciences, and Fellow of Andhra Pradesh Telangana Academy of Sciences, Hyderabad, and the Vice President of Microbiota and Probiotic Science Foundation of India, and also he served as the Vice President of Probiotic Association of India. He served as the chairman for the Knowledge Center for Functional Foods, that is the Committee on Immunity and Gut Health of ILSI. And also he served as the chairman and also member of ICMR Multidisciplinary Research Unit at Gandhi Medical College, Hyderabad. And also served as the chairman for the various committees of Nizam's Institute of Medical Sciences, Hyderabad, and also Kaktiya Medical College and Hospital at Warangal, and also the former chairman of RCGM DBT and a former member of Genetic Engineering Approved Committee under Ministry of Environment Science, and also the chairman for Working Group of Foods for Sports Person under FSSAI. He also has a standing member in various FSSAI committees as on today, and also is a short-term consultant to United Nations World Food Program on Food Fortification, and also a member of a trustee of International Life Sciences Institute, and our scientific advisory committee of DBT NABI, DBT NIPGR, and Punjab Biotechnology Incubator Center, and private companies like Nestle Council on Nutrition Affairs. Also, he is a member, and also Health and Wellness Advisory Council of Coca-Cola India. And twice in 2 terms, he served as a RC member for our CSIR-CFTRI and gave extended valuable suggestions to improve the scope and R&D aspects in CFTRI. He is also a trustee for the Heinz Nutrition Foundation and a member National Committee on Nutrition of the Chamber of Indian Industries. He is bestowed with many awards. Some of them are Professor C.R.R. Reddy Memorial Oration Award of AP Academy of Sciences, Yellapragada Subbarao Memorial Lecture of School of Medical Sciences, University of Hyderabad, and Santinath Ghosh Memorial Oration of Department of Chemical Technology of Kolkata University, Sri Ramachandra Memorial Oration of Nutrition Foundation of India, and S.G. Srikantaya Memorial Lecture of Nutrition Society of Hyderabad. Similarly, another some other things like R.R. Memorial Oration Department of Oncology of Nizam Institute of Medical Science. Like that, 14 such great awards he bestowed. B. Sesikeran is the man who made the know-how for the double fortified with iodine and iron available to the 10 leading salt manufacturers in the country. And he has a simple motto: you are what you will eat. This is what the news column that published some time back in India Today in 2010. Generally, such an extempore talks projects facts on the chosen topic, sometimes gives factorial and also extrapolated outcomes as a way forward to the future. But seldom the audience perceive solutions to their thoughts when they are attending such talks. Dr. Sesikeran's talks always loaded with solutions to the focused topic. That is what I perceived. Almost half a dozen such talks I attended on fortification of his talks in various platforms. Ladies and gentlemen, I request you all to welcome our distinguished speaker with a big round of applause, who is going to deliver a talk on food technology for public health.
Yes, ma'am, to kindly occupy the chair of the dais. Dr. Sesikeran, the chief guest, will be sharing his invaluable insight on how food technology can play a transformative role in improving public health. The dais is over to you, sir.
Good afternoon to everybody. I would like to thank the director of this institute and the staff of this institute for giving me this honor of being one of the Platinum Jubilee lectures. And it's always a pleasure to be here at CFTRI. And I used to know a lot of people in this institute some years back, but I think most of them have left the institute. But it's nice to see a lot of young faces here who carry forward the goal of this CFTRI for many more years to come. So the topic I thought would be relevant is how food technology actually benefits public health. Most often we as nutritionists or physicians or public health professionals think that we are the ones who are delivering public health to the people in terms of vaccination or medical treatment and prevention of diseases and so on. But not many people actually realize that the food products which come into the market, the good ones, actually are the ones which are influencing the public health as well. So I thought, let us see how the Food Technology Institute can actually handle public health. Now, this actually came out of a document released by the WHO. There are two processes with food technology can facilitate public health. One is a curative process, and other, of course, is preventive process. The preventive process, of course, is by improving the nutritional quality of food and ensuring that it is safe and prevents foodborne disease and reduces loss due to spoilage or contamination, and indirectly prevention of malnutrition and starvation. And through socio-economic, it also takes care of trade, giving employment, women empowerment, which I just saw in your millet exhibits. And all these increase the consumers' pleasure and provide a greater choice of food products. So these are all what WHO itself has said is the public health advantage of a food technology. Now coming to curative, of course you have these foods for special dietary uses and foods for special medical purposes. These are not meant for general public, but it is meant for people who have got certain health problems. For example, somebody has got a renal failure and they can't take the normal kind of food, the normal kind of protein. So you have to devise a food for them. Or someone has got a diabetes and you need a special food for that. So these come under the two FSSA categories for foods for special dietary uses and food for special medical purposes. Now coming to the nutritional status in our country, the National Family Health Survey, the fifth cycle took place in 2019 and 2011. The NFHS 6 is concluded, but the data is still not available. But it should be available maybe in a couple of months' time. But in this, if you see the health of women whose body mass index is less than 18.5 kg per meter squared, who are the lean women, are at around 19 to 20%. And compared to NFHS 4, which was the previous cycle of survey, it has come down about 5%. So which means leaner women in the society are becoming less, which means the undernourished women seem to be coming down in number, which is a good sign. Now coming to men also, the lean men are only around 16% compared to 20% 5 years back. That looks like good news, but coming to the bad news part of it, women who are overweight, more than 25 BMI, they were 20%, 21% in NFHS 4 and they risen to 24. And the same is true of men also. From 19%, it has gone up to 23%. Now, this is not something which we actually wanted. Though we didn't want lean people, but we didn't want overweight people either. But that is how the public health is taking shape. Now, among the negative indicators of health is a waist to hip ratio of greater than 0.85 for women and greater than 0.90 for men is a staggering 60%. So the importance of a higher waist to hip ratio or just the higher waist circumference is that all of us who have that problem are prone to non-communicable diseases. The risk of diabetes goes up, the risk of high blood pressure, and also of heart disease and strokes go up depending upon the waist to hip ratio. There was another study called ICMR in-depth study, which was led by Dr. Mohan from Mohan Diabetes Center in Chennai. This was done in 2023. So he said that the overall prevalence of diabetes in our country is around 11.4%. Pre-diabetes is around 15.3%. So pre-diabetes are those whose fasting blood sugar levels are less than 126, between 100 to 126, and postprandial of less than 160. And these are the people who are high risk of developing diabetes in a matter of time. High blood pressure is around 36%. This again is considerably high. And overall generalized obesity, including those who have only waist abdominal obesity, those who have both abdominal and somatic obesity, is around 28.6%, of which abdominal obesity alone is around 40%, and they are the ones who are more prone to develop diabetes. I have seen people in the United States whose BMI is around 50, but they don't have diabetes because most of their fat is under the skin and only a limited amount of fat is in the abdomen. But in our Asian population, other way around, we have more fat in the abdomen, very little under the skin, and that is a risk for insulin resistance. Dyslipidemia, which means high cholesterol, LDL cholesterol levels, low HDL cholesterol, and an increased risk of cardiovascular disease, is around 81.2%, which is very, very high. So we almost have 80% of the population here who are prone to a cardiovascular problem. It's a huge public health problem. And all these metabolic non-communicable disease, except pre-diabetes, were more frequent in urban than rural areas, which means rural areas, you may not see much of diabetes, but a lot of people are already having pre-diabetes. Now, the states which with a lower human development index, the ratio of diabetes to pre-diabetes is less than 1. I'll explain what it means. It means people like the Bimaru states, like Bihar, Uttar Pradesh, etc., where their development index is lower, there are a lot of pre-diabetics, but the diabetics are lesser, which means the conversion of pre-diabetes to diabetes is slower in these less developed states, which means consumption of high energy foods, etc., which is more common in the developed states, is less in these. So this shows that as your development improves, as our incomes increase, we are shifting towards the unhealthy foods, and many of our pre-diabetics are becoming diabetics. So that is where interventions are required. And prevalence of diabetes and other metabolic NCDs in India is considerably higher than what we actually estimated. So thus, there are serious implications for the nation, warranting urgent state-specific policies and intervention to arrest this rapidly increasing epidemic of metabolic non-communicable diseases. So we spent first 30, 40 years of post-independent trying to combat energy deficiency, combat protein deficiency. And now we have shifted to the other. But, come to the question of more than 140 and 1%. Okay. Yes. So the elevated blood pressure among women was around 21%, and elevated blood pressure is around 24% in men. Now, while we are looking at overnutrition and energy excess, we still have the problem of iron deficiency anemia, both in children and in adults, particularly women. There was an important observation was in National Family Health Survey number 4, which was pre-COVID, versus the data which showed post-COVID, there was an increase in the prevalence of anemia. And this has been highlighted, and there have been a lot of discussions on this, whether the pandemic and appropriate. And all said and done, there was a paper published by Anurag Kurpad and others from St. John's who showed that it was actually almost 15 to 20% less than what is estimated. But the fact remains, in pregnant women, adolescent girls, and children under 5 years, it is still high. The difference is only in the rest of the population, which really is not a big difference. So the major reasons for the stagnant levels of undernutrition, particularly micronutrient deficiency among Indian children, is attributed quite a bit to in utero undernutrition. So the thing is, when the mother conceives and the mother is not adequately nourished, the undernutrition effects start taking effect on the baby even before it is born. So when the baby is actually born, the baby is born with a handicap of less of micronutrients in its body. And if the subsequent weaning period and the first 5 years, the nutrition is not adequate, that handicap gets worse. So ensuring that adolescent girls get the right kind of nutrition and adequate amount of micronutrients through various foods which they consume is one of the ways by which we can reduce it. So 50% of the growth failure that is seen by 2 years of age occurs in the womb itself owing to poor nutrition of the mother. So unless we take care of the mothers, we are not going to have healthier babies even up to 10 years of age. Now, there was another survey called as the Comprehensive National Nutrition Survey. We did survey adolescent children, not adults. And if you see that the percentage prevalence of vitamin A deficiency, it was around 16%, same in men and women. Quite a lot of vitamin A deficiency has come down because of the prophylaxis programs. But vitamin D deficiency seems to be high. This data is old. The present data shows that the prevalence of vitamin D deficiency is very high. It's around 34%. So why are we vitamin D deficient? Vitamin D is supposed to be coming from sunlight. And our country is bathed with sunlight more than what we require. There are several factors for that. One is, of course, that our own lifestyles are changed, that we don't go out when in the sun more often. And we wear clothes which cover us almost 90%, so very little exposure of skin for the skin to develop vitamin D. And above all, the present day atmospheric pollution levels, because the suspended particulate matter in most of our cities and even in rural areas is much higher than what is expected. So there are two kinds of rays come down from the sun. One is the UVB rays and the UVA rays. The UVA rays are the ones which make our skin burn. And they are not the ones which synthesize vitamin D. It's the UVB rays. And the UVB rays are very vulnerable to any kind of an obstruction. In fact, they can't come through glass windows. You're sitting in the room, even if the window is closed, but sunlight is coming in, only UVA comes in, UV doesn't come. So there are several such lifestyle changes have taken place, which has actually propagated vitamin D deficiency. Vitamin D deficiency is a very serious problem because every cell in our body has a vitamin D nuclear receptor. So these receptors, when the ligand is the 125 dihydroxy D3, when it binds, it triggers a whole lot of cellular function. So vitamin D deficiency not only will cause osteoporosis or osteomalacia, but it can cause a whole range of things, including senile dementia in the elderly because they're not exposed to sunlight. It can cause cardiovascular morbidity. And there are studies to show that in the presence of vitamin D, the insulin resistance goes up. We did a study many years ago when we took diabetics and gave some of them vitamin D, their insulin requirements came down. So the metabolic advantage of vitamin D is immense. So even though you may think that if your levels are more than 12 nanograms, it should be sufficient. But I think that even anything less than 20 nanograms, you need to take vitamin D supplements. Now we look for fortification. Of course, now through the fortification technology, oil and milk is getting voluntarily fortified with vitamin A and D. So we need institutes like CFTRI to look at this particular problem and see how can we reach the vitamin D to the people through the regular food which they eat every day. What else can we fortify? And in vitamin D, we have one problem. We have a plant source of vitamin D, which is vitamin D2, and an animal source of vitamin D, which is vitamin D3. Since we cannot fortify an animal source because you have to put a notation, but even that is good enough and should be able to mitigate this vitamin D. But best, of course, will be encourage people to go out in the sunlight. Usually around the summer months, it will be little early mornings between 8 and 10. And during winter months, it may be around between 10 and 12. So those are the times when we won't be able to go out because we are held up somewhere inside, and you can't tell your boss, let me go get some vitamin D and walk out of the lab. So, that is practically is going to be very difficult. So food sources is probably the only way we can provide that. Well, zinc deficiency is also an issue. Almost 30% is zinc deficient. Our soil itself is considered to be quite zinc deficient. So therefore, our plant products will not provide enough zinc. So there is a need for fortification. B12 deficiency is also almost 30% in these adolescent children. Folate deficiency also equally there. The problem with B12 and folate deficiency is when you're trying to manage anemia, if the B12 and folate levels are not taken care of, then the hemoglobin synthesis won't be occurring properly. Another issue about folate deficiency is when you have low folate levels, your blood homocysteine level goes up. And hyperhomocystinemia is a risk for cardiovascular disease and stroke, especially because it causes endothelial damage and clot formation can occur. So multiple micronutrient fortification or supplementation is required. And this talks about the lipids. As I showed in the earlier slide, almost 80% of us have an abnormal lipid of some kind or the other. And in adolescents also, they found that high total cholesterol in 4% of the adolescents and high LDL cholesterol, which is the bad cholesterol, that's around 4%. But what is worrisome is that the good cholesterol or the HDL cholesterol is considerably low. The HDL cholesterol is directly related to our physical activity. So when we walk less, when we physically exert less, our HDL levels will come down. And the ratio of LDL goes up, HDL comes down, is a high risk of cardiovascular disease. So there are not many efficient food sources which can stimulate HDL levels. So there are some studies going on. But the fact remains we have to make people physically active. That is how, and these are all children, these are all adolescent kids. And if they have got a low HDL cholesterol, can you imagine how much will be in the adults? Another issue is, of course, osteoporosis. So since we are living to our older age, and then we also have the decreased very low intake of calcium in our population, and along with that we have vitamin D deficiency. Osteoporosis or less of bone is become another major issue, leading to high amount of fracture risk, particularly in the women on the postmenopausal years. But what happens is most of us, clinically, we advise women to take calcium once they attain menopause, which actually doesn't make any difference. The right time to take calcium is in young people when they are in the adolescent age group. Calcium gets accumulated in the bone only until the age of 21 or 22. After that, even if we take calcium, the amount that goes into the bone is very little. So ensuring that young children, particularly girls, get adequate amount of calcium either through sufficient amount of milk and dairy intake or through calcium supplementation. If they don't put in enough calcium in that age of 21, 22, from then onwards, every pregnancy, every breastfeeding occasion, and once the hormones go out, will take calcium out of the bone and make the bones very thin. Of course, there are pharmacological interventions to make the bone strong, but those are not what we are looking at. We need to have a food-based approach. So the Asian Indian women have been shown to have 5 to 15% lower bone mineral density than non-Asian. So this is another problem. Most of us of Asians seem to have a lot of disadvantages. I do not know why. Genetically, we have a problem that we put on more fat inside our abdomen. We have weaker bones. We have smaller hearts. We have smaller kidneys. Everything seems to be smaller. So much so when any organ gets damaged, we have the effect of it earlier. There are many cardiovascular surgeons who do bypass surgery who trained in US or UK and now do the surgery in India. They say doing a coronary artery bypass in India is very difficult because the coronary vessels are so small, whereas they are so big among the Western population. So all these are probably historically, by long years of undernutrition, some kind of epigenetic programming has taken place, and therefore we have all this disadvantage. But nevertheless, we have to face this. You have to maintain the fundamentals of preventing bone loss is to maintain vitamin D levels, and this is very important. Now, if we cannot get vitamin D adequately to our diets, and if we estimate vitamin D, 25-hydroxy estimation is now the best biomarker, but we are also looking for people to improve technology. See, not many people can afford to do this test. This test is expensive. It costs, I think, around 500 or 600 rupees to estimate vitamin D. So if we can develop methods, simple methods, cheaper methods of estimating vitamin D, we can do it at a mass public health level and then give people supplements of vitamin D. In supplements of vitamin D also, we are quite varied. Some say you must take 1,000 units every day. Some say you can take 60,000 units once in 3 weeks. So there is also no kind of a conformity in how you need to supplement for vitamin D. But you go by your individual 25-hydroxy levels. To counsel patients to maintain adequate dietary intake of calcium through calcium-rich foods, and also make at least they get about 100,000 milligrams per day of calcium for women more than 50 years of age. So there are also a lot of clinical people who say that giving calcium doesn't really matter at the older age group because not much gets absorbed. But if you have adequate vitamin D, something at least will get absorbed. Now, this I've actually spoken in the morning too, is that how to have healthier babies through a probiotic approach. So there's enough evidence to show if the mother's large bowel or gut has got good bacteria, those bacteria translocate into the vaginal tract, and during delivery, the baby gets a complement of those good bacteria, which doesn't happen when a cesarean section delivery is done. Also, these bacteria translocate into the breast milk, and the child gets the first dose of good bacteria from the breast milk. And if the mother is in the last days of her pregnancy is going to eat all the wrong kind of foods, she will have all the bad kind of bacteria in the gut, and that will go into the baby. And so ensuring that a healthy, balanced diet is provided to pregnant mothers before delivery is another important intervention. And we need foods which can provide them because their intakes usually comes down during the last months of pregnancy. So we need to develop foods for pregnant mothers which are also enriched with good bacteria. So there are a lot of interventions one can do using probiotics. And probiotics, we all now know that is essential for good gut. But even diets containing good amount of prebiotics should be sufficient. Inflammation is a problem which is affecting many people. This inflammation came to the fore during the COVID pandemic when people who had high inflammatory load as measured by high sensitivity CRP test, they were regularly doing. When any patient went to the hospital with positive for COVID, they used to take a X-ray chest and they do this HSCRP, because those who had a higher HSCRP succumbed to the disease or were severely ill and hospitalized. So this inflammation is occurring because of a variety of reasons. Number one, the wrong kind of foods. then the wrong bacteria in the gut which will let in some of these bad bacteria get into the systemic circulation and create an inflammatory response. So higher levels of inflammation in our body makes us vulnerable to many diseases, including non-communicable diseases. Because the higher the inflammation, the higher will be the insulin resistance, and therefore all the other complications will come about. So probiotics or good prebiotics given to the people so that the gut is healthy and therefore the inflammation is lesser is one approach to lowering the inflammatory load. And of course, plenty of fruits and vegetables which are antioxidant, which are rich in polyphenols, are also a way of bringing down the inflammatory load. Reducing intake of highly processed foods, which are the ones which are high in sugar, high in salt, more of refined grains, less of fiber, is also one way of reducing the inflammatory load. People who enjoy eating these kind of food but don't eat the traditional food will have a higher amount of inflammation, and they will get we won't feel it. It's a very silent thing. Both diabetes and inflammation is not something. This doesn't cause pain. Only on the day we develop an infection or develop a problem, then when you analyze, we realize what is the status of our metabolism. So keeping inflammation down through various methods is one more way. This, of course, shows a cascade shows how if you have a high-fat diet, it will increase the permeability of the intestine. The bacterial cell wall lipopolysaccharides will enter the circulation. The immune system will put an inflammatory response. In turn, will cause insulin resistance and then leading to metabolic syndrome and obesity. So metabolic syndrome is highly prevalent in our country. Many young girls who have metabolic syndrome also have the problem of polycystic ovarian disease, which leads to a lot of infertility-related problems. So there is a chain of events related to food. And something like simple, healthy options will be able to avoid all these. And of course, it's the gut-brain axis. We are now in enough information to show that a good, healthy gut and good, healthy bacteria actually communicate to the brain. So these bacteria produce neurotransmitters, which are chemical transmitters which are present normally in the brain and the nervous system. Now we find them being made by the bacteria itself. And the question is, why do bacteria make neurotransmitter? Obviously, it's a communication molecule. So they are trying to communicate to the brain, to the neural system, which is already existing in the intestine. We know that the brain can communicate to the intestine. When we are nervous, our bowel motility goes up. When you're anxious, it goes up. That is the signal coming from the brain to the gut. But now we learned that the gut can also communicate to the brain. And therefore, a lot of work is now being done in looking at foods which promote a particular type of strains of bacteria, which synthesize these neurotransmitters so that they are better communication channels to the brain. And many diseases like autism, Alzheimer's disease and Parkinson's are all being considered to be mitigated using probiotic as an approach. So these are some of the publications. And the gut microbiota could be a novel target for autism spectrum disorder, which is quite a problem now among children in our country. Many parents are having a challenge managing these children. If it can be at least brought down to a certain extent through proper diet with right probiotics, it may be a great advantage. Of course, age-associated disorders, even mental disorders, seem to be related to the gut. So the gut has now become a second brain, which seems to be associated even with psychiatric problems. So the proper gut will, if it can manage these diseases, it would be a simple solution. Okay, and they also preclinically, they're measuring the gut microbiome, identifying by metagenomics the kind of bacteria in the gut. They say that they can even predict whether an aged person is going to develop Alzheimer's disease. Then come to functional foods. Because we've got a whole lot of functional foods which we can harness to improve our health. And many of these common foods which we consume all have prebiotics like chicory root and garlics and onions, bananas, flaxseed, wheat bran. So we are every day consuming a lot of prebiotics, and which means which we take our regular traditional food or conventional food, we should be having normal bacteria in our gut, and most of these problems may not happen. The problem comes is we have shifted out of these traditional kind of diets into refined diets, and that is where our gut has changed. So a functional food could be either prebiotics or probiotics. I always say that probiotics is only as a temporary measure when we have a gut problem. Long-term measure should always be a prebiotic-rich food. And you can choose based upon, we'd have the food composition, and based on the availability of the fiber, you can choose those foods to have a healthier gut. And these can be given either as fortified food, conventional foods, or as dietary supplements. So oligosaccharides, which are now fructooligosaccharides, are even used as sweeteners. People are slowly replacing non-nutritive sweeteners with fructooligosaccharides. And of course, galacto-oligosaccharide, the good example is the human milk oligosaccharide, which is present in the breast milk. And that specifically promotes the growth of Bifidobacteria infantis, which is the first organism which grows in the gut of the baby. So the nature itself provides the prebiotic for the baby through the breast milk. And similarly, we can look at other form of galacto-oligosaccharide which can be given at later stages in life. Several non-starchy carbohydrates also have inulin-like action, which we get through our regular foods like beta-glucans, dextrins, and so on. And they also help our gut to be healthy. Polyphenols, we all know, are good for health. And recent evidences have shown that many of these polyphenols are not fully bioavailable, nor do they stay sufficiently long in the gut. So it has been shown that some of the gut bacteria actually can increase the bioavailability of these polyphenols and also increase the half-life in the plasma. So one example, of course, is the estrogen-like isoflavones present in soya. They actually get activated by certain bacteria in the gut, which is commonly seen among Asian population, not in the Western, to another polyphenol called as equal. And it's the equal which is the one which is functional and not the other ones which are naturally present in soya. So there are also a lot of polyphenols which help bacterial growth, like resveratrol in grapes, anthocyanins in berries and pomegranates, and also even tea catechins are known to help in gut health. So these are all new scientific advances which are coming in, gives us an opportunity to design foods which will keep us healthy and keep us away from the other unhealthy foods. Postbiotics, your own research in this institute by Dr. Halami's group has shown that not only the live bacteria which are useful, even the dead bacteria are known to be beneficial. The cell wall of the bacteria, the short chain fatty acids that they produce, and many other parts of the bacteria, every one of them seem to have a health benefit. And this is the new era of postbiotics. You may not have to give a bacteria as such, but you can make a bacterial product, something which is made by the bacteria, metabolite, and add it to food and give it for a health benefit. So these are, of course, definition of postbiotic is that they are inanimate microorganisms, unlike the live microorganisms which are probiotics. There are several postbiotics are available, now being discovered, like bacteriocins. Some vitamins itself are postbiotics because they are made by the bacteria. And the cell surface substances. And these are the various functions these postbiotics have. They can act as anti-inflammatory, bactericidal. And this bactericidal is something I would like to insist is nowadays we are facing antibiotic resistance. Most of the bacteria don't respond to the usual antibiotics because we have misused them. So now we need substitutes for antibiotics, and it looks as though these postbiotics could be a good substitute because they inhibit bacterial RNA, they inhibit bacterial DNA synthesis exactly like antibiotics. So we should now use them as an alternative to antibiotics. So now coming back, what can food technology do in the present moment? Number one, I think you should find a technology to enhance satiety. One of the reasons why people who are overweight are not able to reduce weight is they can't control their hunger. So the present drug, which is semaglutide, which has come, which is called Ozempic, is what it does is it shuts off the appetite by GLP-1 action, and you don't feel hungry. So can we have foods which suppress appetites? And that in itself will be and help for people who wish to reduce their intake. We need foods which are lower glycemic index. In fact, like this institute, the carbohydrate division did a lot of studies on how you can even make white rice less glycemic by various processing technology. So we need to propagate this technology so people who cannot live without rice should be able to eat rice if it has got a lower GI value. Ultimately, what matters is not the total sugar which goes in, but also the speed at which it goes in. So the spikes in the sugar after we consume are more dangerous than a consistent higher sugar value. So looking for low glycemic options and other newer alternatives for non-nutritive natural sweeteners. Now, many of the sweeteners are now being said that they may not be all that good to take. So people are going for natural sweeteners. We already have stevia. Now we have monk fruit also as one of the options. Maybe there are so many Indian foods which can act as a sweeteners. And now coming to blood pressure, we need a salt which gives low sodium. We already have a technology of blending potassium with sodium, but we need salt which will give less of sodium. And we also have to encourage foods which have high potassium, because if we take high potassium food like fruit juices or fruit sources or any of them, a higher potassium intake will increase sodium excretion. And that is, so there are two ways you can lower blood pressure, either by reducing sodium intake or increasing sodium excretion. Both things can be done through appropriate food products. Then, of course, fortification is what we already talked about. We also need the enhancers for bioavailability. So many of these good things, like I told you, polyphenols, are present in our food, but they're not bioavailable. If they're not bioavailable, how do we know it's going to give us benefit? So we need to study bioavailability of many of these substances and see what will enhance bioavailability, and also get rid of inhibitors. Like, for example, phytate is a well-known inhibitor. How do you minimize phytate? Like that. And then foods which reduce inflammation. So finally, you need to help us to define and categorize processed food based on health risks. That's what I was telling you, madam, is that we are not able to bring about a regulation to reduce the use of ultra processed food, for the simple reason the definition of ultra processed food is faulty. So we ourselves should now clearly define and tell the industry these foods will be labeled as ultra processed and rest of them will be okay. The public and media also are mistaken in saying all processed foods are bad, which is not true, because without processing we cannot get food. That's the most important thing. Everything, when you convert wheat into wheat flour, it is processing, isn't it? When you polish rice, it is processing. So that is not the right thing. Ultra processed food, where the original format of the food is completely lost, those which have very high refined carbohydrates, those which have high salt, those are the ones which should be separately labeled, and we need to find a definition with the industries agreeing to it. And once we do that, our regulation gets a lot easier, and the public also will know what to consume and what not to consume. So these are some of my thoughts. I thought in which how CFTRI and any food technologist can actually apply their intelligence and come out with product which will benefit public health. Thank you very much.
Sir, your insightful perspectives on leveraging food technology for the improved nutritional outcomes towards the public health is fascinating. And right from the NCDs and how the food plays an important role in achieving the public health. The medicines comes later, but the food that affects the health first was been taken. And thank you for appreciating the institute and also giving a new direction to work for us. Thank you very much, sir. I request the director to please come on to the dais. If there are any questions, the audience.
The only thing is, see, the cutoff values are the ones we should think of. So based on the present risk factors, in fact, Dr. Mohan has said that we are, instead of looking at only fasting blood glucose and postprandial blood glucose, he says 1 hour post-glucose blood glucose can pick up more potential diabetics than these two itself. So he's now trying to do a study to show like that. So there are certain biomarkers can be improved upon. At the moment, you're only following the international standards. That's all.
Was there any link between that or low-grade sustenance of the virus in the system for long period and decrease in DMT or,
You're absolutely right. See, what happens is when you have inflammation, so elevated leukotriene levels, etc., the liver starts producing another protein called hepcidin.
Hepcidin, yes, sir.
Okay, and hepcidin is an inhibitor of iron absorption. So when people who have inflammation is one more contributor for decreased iron absorption, which is a fact. And during the COVID period, there was considerable amount of inflammation, whether that is responsible for low iron absorption or non-availability of iron-rich foods was responsible. We don't have any data. We are only speculating. Okay. But there is enough scientific evidence that inflammation reduces iron absorption. Yes. That's one of the reasons I say vitamin D itself will reduce inflammation. So one of the theories is when you're vitamin D deficient, your inflammation is high, hepcidin is high, iron absorption is low. So you cannot give iron when a person has got vitamin D deficiencies.
Okay, sir.
So that link definitely is there.
And are there any link between skin microbiome? Is there any between nutrition?
Skin microbiome.
Skin microbiome.
Skin microbiome, yes, that's a totally different field on which we not concentrated because it's on the surface. But already there is people are doing research on that. We have cosmetics which contain probiotics. Okay. We have face creams. We have creams for acne containing probiotics. And in fact, they say that like we were discussing some time back about using very strong soaps and very hot water, you will kill all your skin probiotic bacteria. And that in itself will increase our risk of skin inflammation.
Because it doesn't gotten as much as attention as gut microbiome,
Yeah, gut microbiome is attention because maximum research has gone into this. Skin microbiome, now there are a lot of information on oral microbiome.
Yes,
oral microbiome and in diabetic infections of the oral cavity. There's a lot of the microbiome of the respiratory tract. It's there all over. But our concentration, since it's food related, so we are looking only at the gut.
Thank you so much.
Very good afternoon, sir. Sir, I just had a question regarding the HDL to LDL ratio. So we know that there is some literature which is available that EPA or DHA, mostly EPA supplementation can help with the balancing of the ratio between LDL and HDL. But as we are not able to make food which is high in omega-3 fatty acids, as well as we are having so much omega-6 fatty acid rich oils. So in that manner, is there any way that ALA can also have the same benefits? Is there any research regarding that? And will it have a positive impact on the ratio?
Yes, in fact, that ratio is doing us more harm. If you see that even recently there was an issue about high omega-6 and linked with colonic cancer. See, we shifted from traditional oils like groundnut oil, gingerly oil, mustard oil, somewhere in the 70s and switched over to sunflower and safflower oil, which are exclusively omega-6 oils. Okay, this high load of omega-6, with no balancing of omega-3 in itself is a pro-inflammatory kind of a situation is being created. So I agree. In fact, now with that ratio should be maintained between omega-6 and omega-3, whether it is linoleic acid and alpha linolenic acid is being made, the ratio of 5:1 has to be implemented. In fact, the oil blending oil regulation now permits only 2 oils to be blended. We are actually suggesting that you should allow 3 oils to be blended to balance the omega-3. So that regulation has not come. So now there are a lot of blended oils where they are using rice bran oil and soybean oil, okay, where the MOFA, the N6-POFA, and the omega-3 are balanced. So you are absolutely right that omega-3 is low, omega-6 is high, it promotes inflammation.
Thank you very much, sir. And just another question, directly not related to food technology. We were just hearing about the differences between the Asian population and the probably the Western population with regards to kidney size, liver size, a lot of things. Is the prevalence of autoimmune diseases there? And we are not having that much of autoimmune diseases here, lupus, amyloidosis, whatever. So is that a positive aspect of our genetics? Can we say that?
No, probably. See, I do not know about autoimmune, but definitely allergies. You know, the cleaner the environment becomes, the more is the risk of allergy. So the West, in our country, still it is not all that hygienically clean. We do get some other bacteria. And also the fact that exclusive breastfeeding is much more here than in the West. So the early days of a child's life, if sufficient amount of gut bacteria go into the gut, that will prevent allergic inflammation. Autoimmune disease, of course, is a very complex thing. As you said, it is little lesser in India. I don't say it is little less. It is going up considerably. We have rheumatoid arthritis, autoimmune renal problems, etc. We increased tremendously. Whether they are related to the highly refined foods which are being consumed in the West, which we are also now taking now, that could be one possibility. But gut bacteria is also related to autoimmune problem because it's heightened inflammation again against the body's own components. But we have no data. It's all highly speculative.
Thank you very much, sir.
Good afternoon, sir. So I have a general question. So probably we're all aware that from past 1 to 2 decades, cesarean became more common. So do you have a data that the natural birth and the cesarean?
Yeah, there is a lot of data.
Health status.
Yes, there are a lot of data.
Natural is better than
cesarean sections have increased tremendously, and for many reasons. One is very often the mother itself opts for a cesarean section, or sometimes what happens is in a healthcare obstetrician doesn't have the patience. Okay, like many years ago there used to be an obstetrician in Chennai called A.L. Modalyar. A.L. Modalyar, he was a vice chancellor of Madras University. He was a very noted obstetrician. That man said that delivery involves watchful expectancy and masterly inactivity, in the sense that you just wait and watch the mother to deliver the baby will come out. The very rare instances of obstructed labor alone deserve cesarean section. But nowadays, there is a move by the government to put a cap on this, and there's a lot of awareness being created among public to go for normal deliveries. Yes, cesareans have gone up, but we are trying to say puts fear into the mothers through this probiotic route also.
Thank you.
There's one lady wants to talk.
Thanks for the very informative talk, sir. This is a question which I raise in almost all fora. This is with respect to the fortification, especially the iron fortification. We know that not all women are nutritionally deficient anemia they have. There are people who are also thalassaemic minors who are not able to incorporate or get hemoglobin synthesized. So in such instances, don't you think such kind of fortification will be harmful to such populace?
See, there may be some different variations in iron absorption. There may be some women who got folic acid deficiency, vitamin B12 deficiency, or as he said, inflammation inhibiting iron absorption. But fortification is something which is going to benefit a large population, and there may be a small number who may not get the benefit out of it. When it comes to will it do harm, I will guarantee you that it won't do harm because it is in such small quantities. It is barely meeting 1/3 of the RDA of iron. So at that level, if you are giving supplements, for example, you are giving 100 milligrams of iron to a pregnant woman in the antenatal period, here you are giving 5 milligrams. So when that is not causing any significant harm, how will 5 milligram cause any harm? Even if it is not required. At the most, it will be unabsorbed. People have also said it may alter gut microbiota. But the gut microbiota keeps changing depending on our day-to-day diet itself. The mere change in gut microbiota doesn't mean it is causing harm. Causing harm will be only when you have significant adverse effect of consuming that amount of iron. For that, we don't have any evidence now.
Okay, thank you, sir. And one more small question. This is with respect to, I'll ask you, maybe there.
Okay.
Want to ask?
Okay. Time also.
Thank you, sir. As a token of our appreciation, we request you to accept a felicitation. May I request a director to kindly do the honors? Thank you, sir. May I now invite our respected director, Dr. Sridevi Annapurna Singh, to deliver the presidential remarks.
Good afternoon to all, and today's Platinum Jubilee speaker, Dr. Sesikeran. Thank you very much for accepting our invitation, and more so it coincided with the POSHAN PakHWADA, so it was a kind of double bonus. And thank you for the very effective talk. I'm sure this hall is having quite a few young women, and I hope you are inspired to have good nutrition and make sure that you are contributing both towards your health as well as the children who will be born very soon. So this Platinum Jubilee celebrations we initiated in October 2024 when we entered into the Platinum Jubilee. And we've had, this is the third lecture in the series. Earlier we had Dr. Ramasamy and also Dr. Rakesh Mishra, former director of CCMB, who have given these talks. And nutrition is so intricately connected to food technology, and they are like the moral police men, I should say, or women, because we keep removing a lot of things from food, especially the grains or the fruits and vegetables, to make sure that we are enhancing the shelf life and improving the sensory quality of the food. So the nutritionists are the one who keep telling us what we should not be doing in this process of making money for the industry. So when this institute was initiated in 1950, the main crux was that because of the, I should say, the World War II the institute concentrated more on increasing the shelf life and processing of the food and making sure that people far away who had either a natural disaster to deal with or who were starving and so on would get that food. And after about maybe the first decade, it was very effective till then, that mainly undernutrition was being addressed. So we had products like the Indian multi-purpose food or Mysore flour, then other products which were food to food fortified or fortified with chemicals to make sure that many of the deficiencies in the population were addressed. Then there was a realization that we did not have sufficient amount of milk being produced, and products like Milton came into the market, and these were basically having milk as well as edible groundnut flour, groundnut isolate, which was 90% protein. So all of these were addressed in the initial years of this institute. And after that came the realization that we needed trained people. And it was at the UN level that there was this realization that there were not too many trained personnel in various countries of Africa as well as Asia. And that is when the training course and the MSc Food Technology course was started at this very institute. And a large number of people did undergo this training. Then came a time when we were looking at processed foods to process them for convenience as well as cost and large scale. So that is when many of these instant mixes and so on were brought into the market. And these became very convenient for people who were going out to work, whether it was the women or the man or many of the NRIs who were settled elsewhere in the world to get traditional foods. And also automation and therefore the machines which can make large number of these dosas or idlis or puris and cater to canteens or the army or other people in hostels, all of them to get the traditional taste while being warm. This was concentrated upon. Then came the time when we had to look for alternate sources of food. So whether it was spirulina or any other, even millets, though we were working since 1950s, a lot of processes and products were developed. And then we started looking at the nutraceuticals and functional foods. So at almost every decade or 1.5 decades, this institute has been changing its way of work to really embrace what is the requirement of the population on the supermarket. So the mode of action is still being worked out. Many of the scientists over here are looking at either from traditional sources or from grains which are imported to understand how they bring about their health effect, how much of it has to be taken, what should be the serving size, and what should not be eaten along with it. There has also been very recently, maybe around 5 years back, we have started looking at our traditional Ayurveda and trying to understand the same effect and also scale up these products so that we contribute towards Ayush Ahar. So the last decade or so, more and more scientists all over the world have realized about personalized nutrition and how we have to make foods for targeted population. And that is another area that we have started and initiated work. I'm very, very happy today that our thoughts align with what our chief guest and Dr. Sesikeran also showed in his slides, that we need to work towards improving the gut microbiota to make specialized foods. Incidentally, we do have the only institute in Southeast Asia, that is the All India Institute of Speech and Hearing, which is there in Mysore. and they do get a lot of children who are autistic, and they had also approached us if we could help them. So I think you have given us a lot of ideas as to what we should be doing. Maybe in the next decade or so, hopefully this institute continues to be as relevant as it always was, and we broaden further and further to not only just make foods but also to educate people, to help to formulate government policy, and we train many of the people who are entrepreneurs to make the right kind of food so that we are healthy. And incidentally, I have read that about 4% of the GDP is lost because of nutrition related able to tackle this and also reduce the health burden in our hospitals. So I think CFTRI has its work cut out, which is a very, very large task. And hopefully we will get at least some answers which will definitely help our country and our people. Thank you once again for a very nice talk. Thank you.
Thank you, ma'am, for highlighting how CFTRI shaped its science, research, and technologies to address the problems of the society, in other words, the nation. Thank you so much. Moving on, may I invite Dr. Gopinath to propose the vote of thanks.
Good evening. So it's indeed a great privilege and honor for me to extend the vote of thanks on behalf of this institute. First and foremost, I should extend my heartfelt gratitude to our chief guest, Professor B. Sesikeran, for accepting our invitation and gracing this occasion with your inspiring and insightful address on food technology for public health and how exactly food technology facilitates public health. Actually, the figures and facts you presented is really alarming. And the solutions, whatever you have listed out, we are already working on, for instance, how exactly food affects the orexigenic, anorexigenic hormones and bioavailability problems. We're already working on it. So, in fact, your words have really added tremendous value to a gathering and opened up new dimensions for us to think and act upon. So, really will work on this, sir. I would also like to express my sincere thanks to Director Ma'am for your continued leadership and support. My sincere appreciation goes out to the INP department, IT department, Agri Horti, Estate Management, and Audiovisual support for the technical assistance throughout this event. We would also like to sincerely thank the organizers of the network meeting, especially the head MFT and the other support faculties for these arrangements. A special thanks to our CFTRI 75 team for choosing stalwart speakers and making all these arrangements. I also take this opportunity to thank all the heads of the departments, faculty members, students, and whose presence and enthusiasm have made this session really vibrant and engaging. Last but not the least, a warm thank you to everyone in the audience gathered here today. Thank you. Thanks a lot. Thank you for the anchor for doing a wonderful job, Dr. Purnima.
Thank you, one and all. I request all of you to kindly raise for the national anthem. I request all of you to kindly join for the high tea. Thank you.